I'm here today with American Red Cross Medical Director, Dr. Erin Goodhue. Am I saying that right, Dr. Erin?
Yes, Dr. Goodhue, Erin Goodhue. Yep.
Yep, okay, well, thank you. We're here to talk about how Red Cross blood donation testing for COVID-19 antibodies provides a new opportunity to help patients battling coronavirus. Good morning, Erin. How are you?
Good. Thank you. Thank you very much for having me.
Well, thank you for joining us on Morning Blend. There's been a lot of confusion around COVID-19 testing. What are antibody tests and how are they helpful?
So, antibodies are substances in your blood that your body makes to fight off an infection like a virus, as we're speaking about today. And the American Red Cross has implemented an additional antibody test very recently that makes us able to look at donations from any of our blood donors at any of our mobile sites or donation sites across the United States and potentially process that donation to be convalescent plasma, with the experts discussing a potential second wave late fall, early winter. The American Red Cross wants to be as prepared as possible so that patients suffering from COVID-19 have access to any possible therapeutic option.
Can you briefly explain how this antibody testing is different from what the Red Cross implemented in June and why it's important as we prepare for a second wave of COVID-19 infections?
So the first antibody test we implemented in mid-June was able to show our blood donors if they'd potentially been exposed to COVID-19 disease. But now with the addition of this second test that looks at a different type of antibody, we're able to process those donations if they meet predetermined criteria to become convalescent plasma. So this will allow us to have more convalescent plasma donors available for a potential second wave.
Now, how do convalescent plasma transfusions potentially help COVID-19 patients?
So convalescent plasma is a historic treatment, kind of an old standby. It was used even in the Spanish flu outbreak of 1919, early 2000s with the first SARS outbreak, MERS outbreak, and even recently in 2013, 2014 with Ebola. Convalescent plasma is that watery yellow portion of blood that has all the antibodies in it, those substances that fight disease. And if we take plasma from those who have recovered and battled and recovered COVID-19, and doctors transfuse it to those currently suffering, early studies have shown it can potentially be effective, but they've definitely shown that it can be safe.
Now, what if you don't have antibodies and how does your blood donation help?
So even if you do not have antibodies to COVID-19 virus, your donation will definitely help. Every 2 seconds, a patient in the United States needs a blood product, be it a trauma patient or someone who's suffering from cancer and needs transfusion therapy for several weeks or months. We will use and be grateful for any and all blood donations we receive. So please join us at redcrossblood.org.
Well, doctor, let me ask one more question.
Of course.
How do you really think there's going to be a second wave? And if there is a second wave, how will the flu and the possibility of having a cold affect all of this?
That's a really great question. I think there's still so much that the medical and scientific community are working to understand if there is potential interactions between the virus that causes COVID-19 and the flu, and trying to understand those determinations. At the American Red Cross, we just want to make sure any patients who could potentially need the convalescent plasma are able to get that plasma. So we're just trying to plan ahead for that. And any donors who would like to help us can please join us and find a donation site close to them at redcrossblood.org.
Now, one more time, where can our viewers go to schedule an appointment to give blood to help out all patients this fall?
We would love any donors who would like to donate a blood to help any patient in the United States who needs it to join us. Check out redcrossblood.org, find a mobile site or a donation center convenient to your home. I was going to say, or your work. For many of us, those are the same currently. So check it out and please come join us. We would love to have you.
Definitely. We've been talking with Executive Medical Director at the American Red Cross, Dr. Erin Goodhue. Thank you so much for joining us on Morning Blend.
Thank you very much for having me. I really appreciate it.
We appreciate you. Thank you so much.
Thank you.